Welcome to the first virtual Art of Recovery Expo. I'm Barbara Nicholson Brown, and I want to thank our sponsors, Community Bridges, the behind the scenes team, and everybody involved, our panelists that have worked very hard to put this together as we celebrate Recovery Month and suicide awareness. And I'd like to introduce to you Stephanie Sept of Community Bridges.
Thank you. Yes, I'm Stephanie Sept, the Public Information Officer for Community Bridges. Thank you for joining us for this very special event, our first virtual CARE. We have an impressive lineup of speakers here to discuss suicide, trauma, homelessness, and addiction, all very important issues that we hope you'll share with your loved ones. Our goal here is to save lives, and we know we're in good hands because we have our keynote speaker and moderator, Brandon Lee. He's a well-known news anchor who's been in recovery for 10 plus years and wrote a book to document it. He's going to share some of that story with us now. So without further ado, let me turn this over to Brandon Lee.
Barbara and Stephanie, thank you so much. Hi, everyone. My name is Brandon Lee. So good to be here with all of you today on this virtual event. I know it's a little weird during the pandemic. I think we're all just trying to figure out a way, right? One foot in front of the other and really survive this thing. We can do that. We can do that when we've got support around us, and we do that by holding events just like these. As Stephanie and Barbara said, I'm a local news anchor here in Phoenix, Arizona. I anchor the evening news on CBS 5 and 3 TV weeknights. But that's just a small sliver of my life. And I know a lot of people who don't actually get to know me, maybe they tune into me nightly. They see a perspective of my life and they actually think my life is perfect. And actually, that's what got me to even write my book, believe it or not. I had never had an intention to write a book about my childhood trauma, which I'll get into, and also my addictions. But it was a few messages that I actually received on social media from viewers. And one that struck home for me at this one point in time, I got an email. And this gentleman said, he goes, "Brandon, I wish I had your life." And I thought about that, and that actually cut at me, because I think if that gentleman actually knew my entire story, he would not want my life. He may want the life that I built for myself now through recovery, but nobody would ever want to take my life back to when I was a kid. So that's actually where my story begins. I grew up in Orange County, California. I was born in 1980. From the outside looking in, I had the perfect life. Orange County, California is beautiful. I grew up in the beach communities of Laguna Beach, Corona del Mar, and Newport Beach. Went to private Catholic high schools. My family was well off, and we never had to worry about putting a roof over our head or putting food on the table. My parents were gone a lot because they worked, and so there wasn't always a lot of supervision around. But they afforded me so many opportunities. I played international soccer at a time when I was a teenager. But life at the age of 15 for me went off the rails, right? So from the outsider looking in, this kid had the perfect life, set up for perfection and success. That's not how it happened for me. So at age 15, I started abusing cocaine. And at age 15, I became a sex addict. I wouldn't find out the answers as to why at age 15 I decided to numb myself until I really started to dig deep. But that didn't happen until I was about 28 years old. So at about age 19, age 20, I ended up getting accepted into NYU. I learned at a very young age, work hard, play hard. So I actually succeeded in sports. I succeeded in school, like many good addicts can do. And I ended up getting into NYU, and I moved across the country to get away from my family, as I think a lot of teenagers love to do sometimes. But at the same time, as a 19-year-old kid, knew that I was gay. That was tough, because there were no professional athletes who were gay. And here I was playing international soccer, knowing full well that I was different, that I was gay, but I couldn't tell anybody that. Because back in the early 90s, you were only gay if you fit that stereotype of being feminine or even a drag queen. That's the perception that so many people in the public had. So that was a huge sense of shame that I carried with me. So I was in New York City, and finally I found my people, right? Suddenly I was thrust into New York City, and I'm like, my goodness, there's a lot of gay people around here, a lot of gay people who look like me. And that was really my introduction when my drug use really began, living in New York City with the nightclubs that really don't get rocking until 7 a.m. on Sunday morning. We used to go to sleep and do disco naps Saturday night, wake up at 7 o'clock in the morning and hit the nightclubs. My drugs of choice were a drug called GHB, which is also known as a liquid date rape drug. I gave that to myself. That and ecstasy, and used to go to raves and the parties and all that stuff. Fast forward almost all the way to the end. Let's get to the end of it. And it was about a month of near-death experiences. At the time, was a reporter for KTLA News in Los Angeles. Now, when the news got done at 11 o'clock at night, I would go to the parking lot and I would get high. And I used to go to some really run-down, seedy parts of LA. I literally was reporting and anchoring the news until 11 o'clock at night. And that's when my real life began. At night, and I'd be in the parking lots getting high. And eventually somebody offered me one time a pipe with crystal meth. And I said yes. And the moment I took a hit off that crack pipe, I knew that I was done. And I remember that moment because I was staring at myself in the mirror and I saw this darkness come over me. And my eyes turned black. And I tell people that that is the devil's drug, because I felt the devil come into me. And that went on for a period of 6 months. I did everything I could to kill myself. I tried getting HIV because I just wanted to do anything that I wanted to do, have as much sex as I wanted to do in Palm Springs without the worry of that HIV test coming back positive. Drugs brought me to a place that I wanted to get HIV. I wanted a virus that could eventually kill me. That's where my mental state was. It was in January and February of 2010, and I overdosed in the streets of LA, in the slums of LA, and a gentleman that I was using drugs with knew that I had overdosed, and I'm grateful that he at least used his cell phone to call 911. And he left the scene, but at least he told the ambulance where they could find me. And I was naked. I had no clothes on me, and I had just overdosed. I was taken to Hollywood Presbyterian Hospital, and apparently I had cracked my head open, and I had bleeding in my brain. After I came out of that coma, the chief neurosurgeon came over to my bedside and said, "We're going to have to do brain surgery on you this afternoon. You have bleeding in your brain, and it hasn't stopped." And I looked at that surgeon, and I said, "Can you understand me?" And he gave me this truly perplexed look on his face. And he goes, "Yeah?" And I'm like, "Great. You can understand me, then you can understand this. You're not doing brain surgery on me right now. I'm going to get out of this hospital bed, and I am going to walk out of this hospital and go to work." And he goes, "You can't do that. We got to do brain surgery." So I signed myself out against medical advice, AMA, and I still have that sheet of paper with me. And I walked right out of that hospital wearing my hospital gown with those little socks with the little rubber things on the bottom so you don't slip and fall in the hallway. I walked right out the hospital doors, walked right down Sunset Boulevard, and I found my Jeep, and I got into my truck. And the first thing I did was open up that center console, and I got my crack pipe out again. And I got high in that same parking lot. A week later, I woke up in a coma in that same exact hospital. The same team of doctors who had saved my life once, they were now saving it twice in a matter of a week. They put me in this little isolation room. I didn't think anybody could hear me. And I was crying. And this little nurse, about 5'0", comes over to my bedside and she holds my hand. And she looked at me and she goes, "Brandon, do you believe in God?" And I said, "No, I don't." And she goes, "Brandon, that's okay because God still believes in you." "I don't have a lot of money," she told me. She goes, "But I do have $10 in my purse. And make me this promise that when you're finally released, you will use this $10, get a cab, and go to my church tonight." She goes, "Every Thursday night they have an AA meeting there. Just promise me you will go to that meeting. That's all I ask." And so I said, "Okay." And I took that $10, I did get a cab, and I got as close as I could to that church. It didn't get me all the way there, and I walked the rest of the way. And I sat there in that meeting in the far back corner of that meeting. And at the very end of that meeting, they were handing out raffle tickets. And I took one, and they draw one raffle ticket to go up and speak. Had to be 100 people in that meeting. I didn't believe in my higher power, but my higher power was believing in me at that time because my raffle ticket was called. I tried to get up and leave the room. The guy next to me goes, "Hey man, he just called his number." And he called me out. And there I go, right fresh off the hospital to an AA meeting. I'd never been to one before, don't even know how the meetings were run. I stand up there at in front of this room of 100 people at this podium, and I broke down. And I said this, "I don't know what I'm supposed to say. I just got out of the hospital, and I just know I don't want to die." I didn't say I was an addict, didn't say I was an alcoholic. I'd never been to an AA meeting. I just stood there in front of this room of 100 people and said, "I don't want to die." And I've been sober ever since that day, February 22nd, 2010. I never went to treatment. I never went to rehab. I went to meetings. And I fellowshipped. After that meeting was done, there was a line of people that came up. A line of people, they came up to me and they gave me their number, and the next day they were taking me to another meeting. The day after that, they were taking me to another meeting. I didn't know what they were doing. They were actually showing me how to stay sober. They were showing me how you can enjoy life. They took me out to softball practice. We played softball with them. I'm like, my God, these guys look like me. They're having fun. These look like guys that I would want to hang out with regularly. They showed me how to get sober. 5 years into recovery, people ask me, "How did you end up becoming an addict?" And I didn't have an answer to that question. And that's when I sought out therapy. You know, my purpose in life now is to end the stigma when it comes to mental health. That is my purpose in life. People ask me all the time, "Brendan, what's God's will for me? What is God's will for me?" And I simply say this: do for others, you will find your will. Do for others, you will find out what your purpose in life is. My purpose in life is not to be a news anchor. My purpose in life is to end the stigma around mental health. To show that you can be a professional and you can be a recovered addict. You can have a dark past like I do. But it was actually through therapy that I realized that why I became a cocaine and a sex addict at the age of 15. I was repeatedly sexually abused as a child by my piano teacher every Friday night. Every Friday night when that piano teacher came and I made a mistake on that piano, he molested me. Every mistake, he groped me. And the groping got more graphic. My youth soccer coach also sexually abused me. And that too happened repeatedly. Little did I know when I went to go make amends with my family, and my therapist told me that my parents needed to know about that sex abuse. And I told my mom, and my mom looked at me, and mind you, I thought I held this dark secret my whole life. I didn't think anybody knew. Because if anybody knew in my mind that I told them that I was a victim of child sex abuse, people would look at me like I was some disgusting human, like I was dirty, like I was broken. So I never said anything. And when I told my mom that I was sexually abused as a child, she looked at me and she goes, "I know you told me when you were a kid." And I didn't remember telling her, and so I asked her, I said, "Well, what did you do? Where did you go to the police? Did you file a police report? Is this guy arrested? Did you think about getting me help?" "No, we just made sure he never came back to the house again." I don't, at this moment in my life, have a relationship with my parents. I have recently forgiven them. It's hard. Recovery is hard and it's painful, and we can learn to mend relationships, but we can also learn to stand up for ourselves. And sometimes the people who hurt us the most can be our own family members. But we have got to end the stigma around mental health. We have got to allow an openness for people to come forward and say, hey, I am struggling, without looking at them like there's some mess up, like there's something wrong with them. There's nothing wrong with mental health. Everybody has a story. We have to be open and willing and allow them to share that dark story with us. It'll save lives. And that's why I believe my untreated trauma, being repeatedly abused and sexually abused as a child, untreated, is the reason why this kid who grew up in Orange County, California, with every resource available, became a drug and a sex addict at the age of 15. We have to treat that unhealed trauma. We have to have events like this that gather some of the best minds in recovery together to find a solution to save lives. And I'm so grateful to be here, and I'm grateful to share my story today. And we begin right now with an incredible panel talking about suicide and trauma. Go ahead and go down the row for me and introduce yourselves.
Hello, I'm Marianne Govea, and I'm the founder of a local nonprofit called Eric's House. And we support people who have lost somebody to either suicide or addiction.
My name is Chrissy Clark, and I'm a therapist at Scottsdale Recovery Center.
Hi, I'm Heather Brown. I work with Mercy Care, and I oversee all of our substance abuse and suicide prevention programs in the community.
Hello, my name is Natalia Chimbo Andrade. I work for Community Bridges as the Director of Community Education and Outreach.
Thank you so much for all of you being here. It's such an important topic when we talk about suicide and trauma, especially during a pandemic, which has really kind of heightened everybody right now. I think we're all operating on a very high vibration during a pandemic, which is only actually putting more stress on those who are suffering from addiction and depression. Chrissy, I want to start with you and talking about unhealed trauma. You know, I think a lot of times people can look at somebody and say, gosh, how did you of all people become an addict, whether it be a drug addict or an alcoholic? Talk to me about how a trauma that goes untreated could lead someone to spiral and choose something to numb themselves.
Absolutely. Unfortunately, that is the case oftentimes when someone is struggling with addiction. Not dealing with an unresolved trauma, suppressing trauma that occurred in childhood definitely contributes to an individual's desire to want to escape through mind-altering substances. Addiction escalates oftentimes pretty quickly, and that is oftentimes the result of someone who's experienced a traumatic event.
And we're talking, a traumatic event can happen to somebody as a child. It can also happen to somebody as an adult. There's been a few instances where I've been in a recovery room and somebody would share a story that, you know, they became an alcoholic at the age of 45. And to me, I was always shocked by that. But then I started to really read about how trauma plays a big role in addiction, and that somebody can experience a traumatic event at the age of 45, that'll get them to start numbing themselves.
Absolutely. I think that traumatic events are something that occur throughout an individual's lifetime, oftentimes, and they definitely are looking to, again, escape what has happened, something that occurred that they're not able to cope with when there's a lack of coping skills or a lack of resources to point someone in the right direction in terms of receiving support, becoming part of a community that might be able to support them. Things again escalate, and when you reference in the recovery rooms, that's oftentimes a place where individuals are going to deal with their substance use, but also are able to address some of the trauma that's occurred in their life and to process and heal from things that have happened.
Natalia, I know that you have a lot of experience with trauma as well, and seeing people with trauma. Somebody who suffers trauma, they can go sometimes two routes. They can either choose to numb themselves with, substance abuse, whether it's drugs or alcohol, but there's also the other life or death aspect of that, and that's suicide. And I remember, even when I was about 15, 16 years old and remembered that repeated sexual abuse that I truly had tried to bury down so deep into my soul because I went into survival mode. But eventually those walls that we build around those traumas begin to crack at some point in our lives. And suicidal thoughts really do become prevalent when that trauma goes untreated.
Yes, exactly. And there are multiple contributing factors that lead a person to a state of crises or even suicidal ideation. Trauma is a huge contributing factor, and then you have to look at the type of trauma that individual is going through. And then if that person decides to self-medicate with substances, that is another factor, because we all know that alcohol is a CNS depressant. It's a downer, and if you are already feeling bad about yourself or struggling with mental health conditions, whether it's diagnosed or undiagnosed, that is not a healthy outlet. And then we look at opioids. We are currently in an opioid epidemic. A lot of individuals are turning to substances, whether it's legal or illegal opioids, to numb that pain or the trauma that they may have endured at whatever point in their life. And there is some research studies indicating that opioids and how they work on your brain receptors can put an individual at a depressive state, which again leads to suicidal ideation. And so to say that trauma isn't an aspect that could lead someone, like I mentioned before, to the point of crises, it is very true. And so it's something to be aware in the field of which I work in prevention and education. It's something that we address. It's something to be aware that an individual who does this work, we need to look at the person's life situations that they have gone through too.
And I think it's important too, right, that trauma for one person may not be trauma for somebody else, that we really shouldn't even judge the level of trauma that somebody endured.
Exactly. Us as individuals, we all handle stress, trauma, whatever you want to call it, or whatever we have gone through in our life differently. We know that there are some people that do have that resiliency and that grit built inside of them where they can endure and come out on the other side, and have positive coping skills put in place, a great support. They seek counseling. But there are others where it might take them a little bit longer to get through that process. Okay, so it's really, really important that we don't undermine someone's trauma or even feelings when they are going through something that is stressful or pretty major in their life, that we are there for them, we support them, and we come from a place of understanding and certainly not judgment.
Heather, I want to bring you into the conversation because I know for me, I was so good at going into survival mode that I built up walls that people always, when I tell people I was sexually abused as an adult, people who knew me as a child, they go, my God, you were like the happiest little kid. You, honestly, Brandon, you always had a smile on your face, like you seem so happy. And I think that's what shocked so many people about my story, people who knew me as a child, and then to come to find out the stuff I was doing at age 15, 16, and 17. How do we identify those kids who have suffered trauma, that are currently in survival mode, who have thrown up walls and become a chameleon to make everybody else seem that everything is fine when we truly know they're hurting and they're broken inside?
So that's a great question. I think there are certain warning signs to pay attention to and to look for, and those vary depending on the age, but there's some common ones to pay attention to. So any changes in mood, any changes in sleep, eating habits, things like that, but also just if you start to hear someone talking about, wanting to die, or just feeling like they're a burden, or feeling like they just, are having trouble dealing with daily life situations, those can be warning signs to pay attention to. And I think right now, especially during the pandemic, it's just so important to ask and check in with each other, because you never know who might be struggling. Many of us are struggling, whether it's a health issue, whether it's a financial, difficulty, a job loss. racial tensions. There's a lot going on right now. So I think we just need to check in. We need to ask. We need to not be afraid to ask the question directly. Are you having thoughts of suicide? I know you're going through a lot right now. And then once they say yes to that, then we just refer them to someone who can actually help. So I think it's important to kind of be aware of resources as well as warning signs. So many people are afraid to ask that question. They're thinking that maybe they might say the wrong thing, or maybe they don't know who to connect that person to if they do have thoughts of suicide. So there's a lot of great resources out there. Mercy Care provides training free of charge to the community, and there's other online trainings and things that are available as well.
You know, you talk about those early warning signs, a change in behavior, and it takes me back when that piano teacher would come to my house every Friday night. I was at school all day, and then when I'd come home, I used to run into my room, and I used to build a fort of pillows around me, and I would hide in the fort. And my mom would go, "It's time for piano lessons." And I'm like, "I don't want to go, I don't want to go, I don't feel good, I don't feel good." And she would allow the piano teacher to come into my room and essentially drag me out. And that would be a warning sign.
Yeah, and I think sometimes it's hard in the moment. Sometimes people aren't aware of those very subtle, maybe, warning signs. But with increased training and awareness, then we can be more alert to those sometimes subtle signs.
And I appreciate you talking about the pandemic. Marianne, before I get to you, Heather, one more thing about the pandemic. And I almost relapsed. I got 10 and a half years. I'm going on 11 years. I almost relapsed in May in the pandemic. You know, I was thrown out of my routine. I'm a routine guy, especially in recovery. I'm very routine and military about my day. And you know, the gyms were closed, things were taken away, the meetings were closed. And yeah, listen, I've done Zoom meetings and they're not the same, you know, and we tell people early on in recovery, the last thing you ever want to do is isolate. The last thing you ever want to do is be home alone. The last thing you ever want to do is be alone in your own thoughts. Well, the pandemic of stay at home is essentially telling people to isolate. And we have government health officials telling people to isolate, stay away from people, don't fellowship, don't go out there and be around groups of people. We are seeing a surge of overdose deaths right now. We are seeing, outpacing COVID deaths. How do we stop that in the pandemic?
Well, I think there's a lot going on right now. As you mentioned, people are kind of struggling and trying to figure out how to adapt to increased isolation, being cut off from their friends, their family members, their coworkers, working at home maybe for the first time ever, trying to parent and also be a teacher at the same time with virtual learning. So there's a whole lot going on right now. I think one of the misperceptions actually about suicide is that suicide will actually increase during a pandemic. And we know actually from the research historically that has not been the case. And when you look at Arizona state data right now, actually suicides are down this time versus the same time last year. So one of the things I just wanted to highlight is that it's important to look for trends in the data and to also recognize that it takes a while to be able to determine if any of that is significant. You mentioned the increase in overdose deaths, and that is something that we're seeing. We don't yet know, though, if suicides are increasing right now. And it's important to consider it's a very complex issue. There are things like seasonality and other factors to consider, but we know that those risk factors are very present. So one of the things just to pay attention to is, as I mentioned earlier, checking in on people, finding out how they're coping, whether it's FaceTiming or reaching out, texting or calling your friends. Don't assume that people are okay right now. And one of the really important and amazing things to point out is that people who are in recovery actually are recognizing their resiliency right now and their strength because of their coping skills.
And you know what we say in the recovery world? They're like, if you make it through 2020, you get 2 years of recovery added to your time. It's essentially what it feels like. Marianne, I want to talk to you. In recovery, I met this incredible woman. Her name is Jody Barber. And she's become fairly well known in the recovery world because of the loss of her son. And I do want to talk about overdose deaths and suicides that do happen in this world. Sadly, when we're in the recovery world, I know too many people I used to run with out on the streets and party with that are just dead. It's really hard. Sometimes when there's an addict in the family, so much attention is always paid on the addict, right? It's always the addict getting all the attention, but we have to realize that addict actually impacts a lot of people in a family. And when that addict dies, there really is a sense of shame sometimes that parents will carry that burden that they could have done more. How hard is it for a parent to recover after, a child of theirs does die from an overdose or suicide?
Okay. Well, I know from personal experience with my own son, Eric, who was a heroin addict, and he died by suicide. And for our family, basically tore us apart for a while. And we see that a lot with our clients. One parent blames the other parent, a sibling blames a parent or another sibling, and it just has a tendency to tear the family apart. And for a parent in particular, they feel like they didn't do enough, or maybe they did things that contributed to the death. And so you end up in continuous process of trying to figure out what happened and try to put the pieces of your life back together. With families, what we encourage people to do is to allow each other the space to grieve the way they grieve. A man might grieve a little differently than a sibling or a mother or a father, and so we encourage them to express their own feelings and to allow each other the space to grieve how they grieve and build a relationship with their lost loved one in a way that's healthy.
You talk about families really tearing themselves apart, and when there is a loss that is that tragic, a lot of finger pointing goes around, in the family. And the sad part is, from the outside looking in, you're watching a family tearing itself apart over something so tragic. But I've also seen in those cases where that has led to more addiction as a coping skill, because that is a traumatic, it goes back to trauma. A parent losing a child to suicide or an overdose, it's a traumatic experience. And that could trigger an addiction.
Yeah, and we do see that. We see multiple substance abuse issues in a family, and we see multiple deaths, and we also see multiple suicides.
The example that I gave of a woman who's close to me, Jody Barber, who lost her son, heroin as well. She now speaks, goes around the country, speaks at high schools, does so much youth involvement. That's her passion now. She has found her purpose in life through something so tragic.
Right. And we do see people who take a terrible tragedy and turn it into good. And those cases take a little time for people to realize, what their loss was and how to cope with their loss. And then they take their experience and they speak out and they try to help others.
Chrissy, how do we differentiate? Is any call of suicide, any talk of suicide, is that looked at as a cry for help? Because I think sometimes when somebody comes forward and they say, I'm having suicidal thoughts, there will be some people who will look at that and say, just looking for attention. How do you decipher what could be just a cry out for attention or a true cry out for help that somebody is actually going to do it? Because I've heard people say, and I don't know if this is true or not, you're the experts, but some people say, listen, if somebody comes and says they're thinking about taking their own life, the people who take their own life don't tell people they're going to do it until they just do it. So how do you decipher that?
I think as a professional and as someone in the recovery world, you take that seriously. Whether you think that it is not true, whether you think that the person is over-dramatizing a situation, you take it seriously regardless, because it is a cry for help. And what is behind that, that will be determined through therapy, through work, through what happens after the intervention. But I think that having an intervention in the first place is the primary goal that needs to happen first.
You guys are all living through this pandemic as well, and you guys are all professionals, and you're seeing the impact of this. I want to go down the row here and just ask you, are you concerned the longer this pandemic is drawn out, and are you seeing levels of addiction or levels of suicide and the talk of that increasing during a pandemic and what we're dealing with?
Most definitely. We're definitely, we have more calls coming into our intake center. We see bigger substance abuse issues, and we're even getting calls for people who have suicide ideations. And part of that is just the isolation and not being able to go out and get help, and not knowing where to turn. And so we're definitely seeing an increase.
I've seen that co-occurring issues, someone who's struggling with anxiety, depression, another mood disorder, and dealing with addiction at the same time, there's an escalation in some of the symptoms associated with anxiety and depression during a pandemic, and so much isolation that it's contributing to addiction and then as well suicide.
And I think, I mentioned earlier that we don't necessarily see suicides increase during a pandemic, but this pandemic is also very different than historical pandemics. So I think it's important to pay attention to, and I've certainly seen this among my friends and my colleagues and family members, people who are more open about having thoughts of suicide right now. It's much more common, and it's probably more common in general than people realize, but especially now. And I think the time to pay attention to, though, is after the pandemic. So as people are starting to kind of reintegrate into a changed world, that's the time to kind of keep an eye on how people are adjusting and coping. And I think you mentioned this earlier, coping skills are so important. So I think it's a good opportunity for us to really focus on developing our own coping skills and not forgetting the basics like self-care, eating, drinking, those basic, getting enough sleep, right? So I think it's just important throughout the pandemic and also afterwards.
Yes, it is really concerning going through this pandemic on the multiple, stressors and barriers and trauma that individuals are facing right now, whether it's the loss of their job or it's their health, or just, the stressors of a working parent and trying to work from home with their kiddos in the house and trying to manage e-learning. So as we talked about earlier, there are multiple contributing factors that can lead an individual to self-medicate or have those thoughts of suicide. But the silver lining through all of this right now, as we are living through this pandemic, is that there have been lots of talk about not only taking care of your physical health, but your mental health as well too. Celebrities are reaching out, individuals in the media, and talking about the importance of positive coping skills, being physically healthy, but also it's okay to reach out and get professional help, if you are struggling, if you feel like your mood is off, if you see any of these warning signs or any of these risk factors with a friend or a loved one. I'm loving this rhetoric that is going around about it's okay to not be okay. And these are the professional supports and resources that we have in the community.
And I think it goes back to, ending the stigma just around mental health, so it allows somebody the freedom to say, hey, I'm struggling. And I think sometimes in the society that we live in right now, we tell someone we're just always supposed to be strong, we're always supposed to be powerful, we're always supposed to have, do well. But I think it's important that we end the stigma, to just give that little bit of space just to say, hey, I'm not doing great today. And even that can start a conversation. And just even by having that conversation really does sometimes lift a weight. I tell my sponsees, hey, just say something. And watch that weight get lifted just by saying something. And that's some of the burden that our thoughts hold, right? Thoughts can be those huge weights. Thank you so much to this panel. Trauma really, to me, is such an important part of recovery and healing, healing the recovery and figuring out where that trauma is coming from and to heal it, so it doesn't trigger any bad response down the road. So thank you again for being here today.
With all the addiction rehab centers across the country and rates of relapse running from 60 to 90%, maybe we're looking at recovery all wrong. Scottsdale Recovery Center is making it right because patients and their families deserve better, which is why we created Lifetime Therapy and our Lifetime Therapy Guarantee. If you think about it, addiction doesn't happen overnight, neither does recovery. But most programs only last 30 or 60 days, and then people are left to fight the triggers of relapse on their own. With our Lifetime Recovery Program, you get the support you need when you need it. After a hectic day at work, or when a personal matter puts your sobriety at risk, we're here, providing the support, tools, and wellness practices to keep you on track 1 year, 5 years, 10 years after you complete a program. Because the right addiction treatment only needs to happen once for recovery to last a lifetime.
And welcome back, everyone. We've got a great panel today. We're talking this section about homelessness and addiction. If you can, just go down the line for me, introduce yourselves and the company you work for and why you're passionate about this field.
Sure. My name is Jennifer Page. I work at Mercy Care, and I'm the Housing Integration Administrator. I'm passionate about this topic because I think homelessness is something that impacts the entire society. Our whole community is impacted by homelessness in some way, so that's why I'm passionate about it.
And I'm Scott Hall. I'm the Homeless Projects Program Manager for Maricopa County. I've been in the field of behavioral health and homelessness for over 15 years now. Very passionate because, these are our neighbors and these are our family members out there on the street.
And I'm Elizabeth DaCosta. I'm the Senior Director of Housing and Community Integration Programs with Community Bridges. And I'm going on about 13 years of recovery here in November. So I suffered from heroin addiction, experienced homelessness, and I understand deeply the impact on me and my family and the people around me.
First off, congratulations on the 13 years. That's an incredible achievement. I really just want to start off, as a journalist, and I've done so many stories about about homelessness here in the Valley. Even the mayor, the former mayor of the city of Phoenix had a plan to get every homeless veteran off the streets. We've done stories, and sometimes when we talk about those who are homeless, the public sometimes just doesn't care or seem to care. How do we as a community, talking about the importance of homelessness and addiction that you all have a passion for, how do we get people and society to care so that we can help them?
That's a great question. And what I've seen, and I've worked directly with our communities, and I haven't seen that where they don't care. There's a level of frustration that builds up, but ultimately what's lying underneath that is caring and wanting that individual to have a better life and the options to be able to do something different. And that's what I've been seeing in our community. It's just to get those stories and messages out there that it's not, people aren't out there by choice. People don't just put their flag down and say, you know what, I'm going to be homeless and this is what I want to be. There's all kinds of things that are associated with that person ending up on the street and what's going on with them. So just continuing to put that message forward and to hear the voices of our communities, because those are real as well. But what I've seen in our communities is that they're very empathetic and they want better for everybody in their community.
Let's break some stigmas while we have an audience for this about homelessness, because I think there's a lot of stigma, when we talk about homelessness and what causes people to become homeless. Because I think sometimes people, they see a homeless person on the side of the street, first thing that goes in their mind, if they're just a drug addict, they're not contributing to society, don't care about them, don't even want to hear about your story. Breaking some of those stereotypes and breaking through some of that stigma, what leads people to become homeless? What are the different causes of that?
So that's a great question as well. There's a lot of factors that can contribute to someone ending up on the streets. Some of those are addiction, mental health, eviction. Homelessness is caused by despair, grief that builds up in people, teens aging out of homelessness, domestic violence. Those are just some of the categories, and you just take one of those alone, that could drive somebody down to where they become homeless. Now compound multiple of those issues together, and it's really hard for someone to willingly want to pull themselves out of that when they're in such despair and in such grief.
We really have to, manage our own perceptions, right? So working with homeless programs over the last 10 years with Community Bridges, we've done a lot of different outreach efforts and work. And so it was really important that we managed our perspective and our perceptions. And when we interacted with folks that were experiencing homelessness, we got to know what was going on with their story. And so just like Scott talked about, it was often that somebody, moved from another state to come visit a family member. And when they arrived, that family member wasn't welcoming them into their home. And so now they were just stuck in an environment that they didn't have much much resources or access to information, and they had no way of getting back, right? We've seen job loss, people who have had great quality jobs but then lost their jobs. They got behind on their rent, then they had an eviction on their record, and then they found themselves in our shelter systems, So not always is it attributed to mental health or also substance use. It's really important for us as providers to just understand, the different ways folks can enter homelessness so that we can figure out how do we help solve it.
And that's with the pandemic, by the way, that we're all dealing with right now. I mean, when we really think about how many people don't have enough money right now even saved up to survive 6 months, let alone the next month. I think we're about to see a homelessness spike in this country because rent is due. And so many people have lost their jobs. And you know what happens when that government assistance, when DES isn't sending out those checks, and you talk about experiencing homelessness. And I love that term because it doesn't have to be permanent. And sometimes it is a job loss, like a single mother, right? Taking care of taking care of her kids and is working multiple jobs, and suddenly the pandemic hits and you don't have a job anymore. But you've got these kids and now they need Wi-Fi, internet access just to do all that compounds to so many people.
Right. And so for us, it's extremely important that we're very creative, that we work together to develop different levels of resources to be able to address homelessness in all different levels. We've been able to be fluid with it. So even in the pandemic, new services have come up. But for us, there's multiple levels of interventions, right? So for the individual who came from another state, we need to have that bus fare so we can coordinate with some level of family or social supports to be able to get him back. Or for the person who is at risk of being evicted, we need to find ways to get to know whether or not that's the case. Are they living in their homes, worried about eviction, and they don't know where the resources are at? How do we get to know their information so that we can connect them with some of the available resources in our community? Things like eviction prevention. And then it goes to multiple levels of interventions though. So for the individuals who have been homeless on our streets for a significant amount of time prior to the pandemic, we also have rapid rehousing interventions where we can move them in with deposit assistance, pay their rent for the next 9 months, provide them with case management services, access to employment, and then also our permanent supportive housing programs where we're wrapping them around with supportive services so that they can stabilize in housing.
So what happens, if somebody is experiencing homelessness and they are addicted to heroin or they're addicted to crystal meth or they're an alcoholic? Can that become a barrier to them finding a place and finding a shelter? I know a lot of halfway houses and a lot of recovery programs. Listen, you cannot abuse a drug. They'll kick you right out of that, that halfway house because they don't want you to impact anybody else who's living there. So how can drug abuse or alcohol abuse impact a homeless person from actually finding shelter?
I think ultimately we don't want addiction to impact an individual's ability to access housing, but we also recognize that there needs to be a continuum of care and a variety of services that are available. So we have services that are available to individuals to address their substance use disorder. But as far as housing goes, we really operate under a housing first model, which basically means that there's no readiness assessment for housing. We don't complete an assessment and say, yep, you're ready for housing. We basically say, we're going to house you and then we're going to support you and help you be successful in your housing. So that's where providers like Community Bridges come into play, and they deliver those services to help an individual be successful in the community.
Right. And just to touch on it, we view it more so that lack of stable supportive housing is actually a barrier to recovery. And just from a personal perspective, when I decided to enter into recovery, right, I had to change everything about my life. I had to change the place that I slept at night if I wanted to be able to stay sober, the people that I interacted with. And so, I went into a detox at Community Bridges, but when I was ready for discharge, it was like, okay, now I no longer have this substance to be able to deal with my emotional needs, but also where am I going to live, right? Like if I get to a recovery home, how am I going to be able to pay my rent in my recovery home? There's all these different environmental things that add barriers to folks who are trying to enter into recovery. What we've been able to do when I talked about being able to think creatively and with interventions was we have our state opioid response grant that comes into our community. Our funders at Mercy Care listened to us. We said, we have the support services. We have the peer navigators providing support services. We have the medicated assisted treatment. What we lack is the ability to pay for someone's recovery home stay while they're engaging in those medicated assisted treatment services. And even from there, maybe they're ready to move on from the recovery home, so we can pay for them to assistance to move into their own apartment and some rental assistance so that they can help stabilize in that apartment. They allowed us to then use that grant to cover those costs. So it's really important that we're able to think creatively on how we address the barriers to recovery.
So how's the pandemic impacting all of this? I mean, when we're talking about activities and resources to get, those experiencing homeless into a shelter or into housing, but at the same time, like, you got to isolate, you got to stay at home, you got to be, like, how is that impacting? Because I think the days of like being able to put a bunch of people maybe on twin beds or in cots and stack them on top of each other, like Salvation Army, how's this pandemic impacting what you guys are trying to do?
Yeah, it's had a huge impact on what we're trying to do within our homeless services system. We've had to take congregate shelter and reduce capacity down to create social distancing space. We've had to create temporary shelter options in hotels that we've leased hotels for a certain periods of time to give people places to get off the street. We even have a hotel that's specific for anybody who's experiencing homelessness that's COVID positive, so that they have that time frame with medical staff on site and behavioral health staff to not only work on their COVID issues, but also work on their homeless issues at the same time while they're there. So all these things have amplified some gaps we've had in our system, but we did receive a lot of good federal money that with good community partners, we've been able to implement out into our communities quickly. So we have all these things going, but yeah, it's reduced capacity in a lot of things, but we've been able to increase some capacity. The governor's moratorium is coming soon to expire, right? Which could exacerbate our homeless issue. But with all these things together, all of the providers and the MCOs and everybody has really come together to try to overcome every single one of those barriers and see what we can do for the clients we serve.
Yeah, a couple of things that Mercy Care was able to do was to use community reinvestment dollars. So this funding was distributed to different housing and homeless service providers in the community so that they could purchase protective equipment and cleaning supplies and phone cards and use it for temporary shelter, things that were immediate needs in our community. And then we also really had to focus on the need for telehealth and the ability to serve individuals, because we can't just stop services because there's a pandemic. Individuals still need supports and services, and so how could we expand our telehealth opportunities? And so the providers could then continue to deliver services, and the individuals could continue to receive the services and supports that they need and not be impacted by COVID. They still need their health and behavioral health services. So I think telehealth was a key component of this kind of expansion and response to COVID. And CBI is a great example of how they use the telehealth services to serve the members experiencing homelessness.
Mm-hmm. Yeah, I think that we've been to work for the last several months on figuring exactly that out. And, it has brought us together like never before. All providers working even at like our downtown human service campus, our medical provider Circle the City, the city of Scottsdale, city of Mesa, city of Tempe, everyone partnering to figure out how do we take these resources that are coming into our community, understand what our gaps are, and use them in the most efficient way to not only address the concerns of the pandemic, but also consider the long-term effects of homelessness and addiction and how this resource is helping to combat that as well. Just how Jen talked about the telehealth services, we were able to assist folks who were residing in some shelters and some temporary hotel settings with accessing primary care appointments over our Community Bridges laptops and computers. So they didn't need to be transported down to a different location. They didn't need to go into the urgent care and be at risk of further exposure. They got to just do those appointments right through those telehealth services. It even opened up where providers can write we need disability verification letters sometimes for folks to be able to access certain housing resources. Just through that telehealth appointment, we were able to quickly get it done so that they could, it would streamline their connection to their next destination. Another thing is that, it wasn't just putting up the shelters and hotels and then not providing supportive services. So funders came in and they funded peer navigators with community bridges. So folks who are in recovery from substance use, addiction, also mental health or homelessness, who are now, they're employed and they're giving back. They're sharing their experience, strength, and hope in those settings so that we make sure that when that individual comes in, they leave in a much better situation than when they came in, right? Their primary care situations are addressed. They are maybe connected to some medicated assisted treatment. They have their prescriptions, and then hopefully they're moving on to their next permanent housing destination.
You know, I know for us during the pandemic, just even in the news industry, right, we've got people working from home. I mean, we've had to totally upend how we deliver the news during a pandemic. I mean, the pandemic has exposed all of our warts and scars, you know, in the news business, maybe where we're overspending or where we're putting too much focus where it needs to be over here. I think it's done that for every profession. Every profession this pandemic has really shown our strengths, our weaknesses, and how we can maybe even better serve, right, the people without expanding so many resources or a better use of those resources. I'm curious is how has this pandemic really perhaps even changed the way you provide services going in the future? I know you brought up telemedicine, and maybe even telemedicine is going to be, you know, you have a monitor at a shelter and maybe they're able to have telemedicine calls with doctors more often. I don't know, how has this pandemic, I don't always want to say it's a negative, right? Because we can always find strength out of something that is so dark in recovery. And so how can you turn this into a strength moving forward to better serve homeless?
No, I think that's great. For us, I think telehealth is definitely one of the areas where we can see that it's working and it's working well. And so, you know, is this something that will continue beyond the pandemic? Because we are being able to demonstrate that it's effective and is helping our individuals. I think as a community, you know, whether it's the county or the cities, we have housing and service providers, shelter providers, health plans, we're all really coming together, and we've come together as a community, and I think that's been kind of a great result of this pandemic as well. And now that we have this momentum as a collaborative, how can we keep that going? How can we push this forward and look beyond the pandemic? So the individuals accessing, you know, the temporary housing resources, making sure that they're connected to services, that they're not returning to homelessness, that they have those supports in place moving forward. I think that's one thing we can kind of take from this. And then I know it's kind of highlighted some of the gaps, like Scott mentioned, you know, that we do have a lack of affordable housing in the community, and that is contributing to homelessness. And so what can we do about that? As a health plan, Mercy Care is participating in Home Matters Arizona, which is raising $100 million to address affordable housing and the crisis that we're experiencing here in Arizona. And so by contributing to that grant, I think we're really trying to address the underlying issue of homelessness within the community.
You know, and what I've seen is with the COVID hitting in Maricopa County and all the cities within it, it's made the issue of homelessness one of the top priorities. It was already trajecting in that way, but city councils and city leadership have been working amazingly, understanding that these are people that are part of the community and we need to help and we need to serve them. On top of that, I've always heard the myth, well, money's not going to fix it. Money's not going to fix it. Well, we had a big influx of money, and guess what it did? It fixed a lot of things and really showed we could do different things. And then I also heard you can't just put people who are on the street into hotels and things like that because of, you'd assume, damage and all this kind of stuff. Well, guess what? We have hotels filled all over the valley with people who are experiencing homelessness. That's a non-issue. Our folks are responding positively. They're engaging. They're even helping one another within these situations. So it's just showing all these things coming together that if you put the energy, the funding, and the ability forward, you can really move the needle on ending homelessness.
Yeah, it's just, you know, kind of going back to the first question, right? Like, we are, our homeless individuals, our community, we are a reflection of each other, right? And so if there is somebody in need in our community and we're not engaged in trying to help them, you know, just live their best life, you know, then it's going to come back to impact us somehow, whether it's because, you know, they end up having to reside in our community parks, or in our alleys, or interact excessively with our police, right? Which then makes it so maybe they're not able to be as responsive to crisis situations that occur. It impacts us some way and somehow. So it's really just taking a look at, yes, what did we do with these additional resources? What's the number of lives that were affected by it? How did we get structure into some of the encampments and provide things like, hand washing stations and restrooms for folks who are homeless to have access to basic hygiene? It was a lot of really great stuff because of the amount of resources that came in. And then for me, like first and foremost is the sense of community within the provider organization. We are working together like never before. So when you talk about efficiencies with the use of those funds, it's vital that we continue those connections. So another outreach provider may come in and interact with that individual, and how does Community Bridges use that as an efficient way to serve the person that we're serving? Another medical provider comes in and they serve the person's physical needs, and we're all communicating and coordinating as a community to be able to meet their needs in the best, most possibly efficient way.
You have 13 years sober.
Yes, yeah.
You
Almost.
experienced November upcoming, God willing, right?
Yeah.
You experienced homelessness yourself.
Yeah.
Were these same resources available to you 13 years ago? And did that motivate you into what you're doing now?
Oh, yeah, they were. The thing for me is that I knew nothing about them, right? So I suffered from heroin addiction and I found myself pregnant. And I knew that, the moment I saw that test, all of a sudden it was like shock, like, I'm supposed to live. I never thought I was supposed to live, right? So when I saw that, it was like, well, I'm going to have a future. And so I actually turned myself into jail because it was all I knew. It was the criminal justice system doing for me what I couldn't do for myself, right? While I was incarcerated, there was another girl that was in there that was pregnant, and she started telling me about this place called Lifewell. It's a New Arizona Family now. It's an inpatient location for women who are pregnant with substance use to be able to go and reside. I moved in there and I never wanted to leave. It was right in downtown Phoenix. And I remember it was like you didn't even know you were in the inner city because of the walls there. It felt like you were on some island, just being able to attend to your needs and start to just, understand your emotions and move forward with recovery. So they did exist. I don't think at this level necessarily, especially for folks who may be single and who are just homeless. They did exist, but I think that we needed to get the information out there a little bit more.
Well, thank you, first off, for sharing your story, a little bit of your story. I'm fascinated by it. I would love to be able to hear the full story, but the work is so important. The work is so important during a pandemic, after a pandemic, and as you said, these people, they're part of our community. And I think if we can just even look at an example like Liz, right? If resources aren't available, if we're just going to give up on the homelessness, you wouldn't be sitting here near 13 years sober, giving back to this community. I mean, looking at you right now, no one would ever guess that you were ever experienced homelessness. And the fact that you're sitting here right now, speaking about that, hopefully will give hope to those who are, but also open the eyes to the public who constantly dismisses those who are experiencing homelessness. So thank you all for being part of this panel and having this conversation. Appreciate it.
Thank you. Thank you.
Welcome back, everyone. I couldn't think of a better panel to end this seminar with today, helping a loved one. If we can't just go down the line, Carrie, I know you. We'll begin with you. Say your name and who you work for and why you're passionate about this.
Hi, I'm Carrie Davidson. I am a therapeutic consultant and interventionist, and I am so passionate about helping families get better because I get to see people get better and families heal. A lot of people think there is no hope. There is, and that's what keeps me going.
Hi, I'm Amy Samuel Maida. I'm a recovery coach at Scottsdale Recovery Center. I love what I do. I love being in this field. I've been on both sides. I am personally in recovery, and I've helped many loved ones who've suffered with addiction. So it's a noble profession to be a part of.
Hi, I'm Ramson Kasha, CEO of the Calvary Healing Center here in the Valley. I love being in this profession. It kind of like what Carrie said, you really get to see change happen drastically, quickly sometimes, and it's just, it's the most honorable thing I can think of doing.
Well, we're lucky to have all three of you here. I know two of you, and we just met, but let's just get right into it. And I love this one. I love this one when people who are not addicts, but they know of an addict, and they look at you so frustrated, and they ask this question, why can't you just stop? Carrie, if it was that easy, you wouldn't have to do interventions.
And if it was that easy, all we'd need is detoxes, Brandon. Part of the problem is where addiction lives. Addiction lives in the reptilian brain, the limbic system. And when people are struggling with addiction, they think that they need their substances as much as they need air. So it's you can't rationalize with the irrational thinking of somebody that is depending on a substance in order to survive. It's just not that easy to say stop.
And you know, you're a professional interventionist. I know that you've held interventions before with family members really trying to get their loved one to maybe get to their rock bottom just a little bit faster before they're dead. I think sometimes, though, the word intervention has been muddied a bit, right? Because of Hollywood and TV shows. And people turn on the TV and they see an intervention and they think that's really how it always goes down. We all know, and myself as part of TV, we like to make things really super dramatic sometimes. When should a family, because I've had people reach out to me saying, hey, should we host an intervention or should we do this? I'm like, definitely not alone, definitely need a professional guiding you. How do you go about doing an intervention, and when is an intervention right for that addict?
Boy, there's about a 4-hour answer right there.
You got 2 minutes.
Try and take it in little bites.
Yeah.
You know, if addiction's causing a problem for somebody or impacting other family members, my short version is, you know, if drugs and alcohol are creating problems, you got a drug and alcohol problem. Real simplify it down. But one of the challenges in trying to reach somebody is there's a lot of smoke and mirrors that go on with the addict themselves, the person struggling. What I'd like to do is come in and educate the families, explain to them addiction, explain to them mental health issues so that they can understand what it is they're dealing with, because it's a lot bigger. So bringing in a professional interventionist, one of the key things is so that it doesn't turn into yet another family fight. And having a professional in there really creates a dynamic to help settle everybody down and make it a true discussion. You know, if someone you've asked and said, hey, you need to get some help, and they refused, it's time to bring somebody in and get some help.
You know what I've heard about interventions, and true or not, I'll let you answer that, but I've heard a lot of times interventions isn't so much necessarily about the addict. It's about the family around the addict and giving them strength and giving them the communication skills to deal with the addict.
Absolutely. Addiction is a systemic issue. It's a family systemic, meaning families are intertwined. They're connected for life, and everybody's impacted. It's kind of like a planets on a mobile. When the addict is one planet, he moves, everybody adjusts to that person's movement. And intervention is about taking control and power back as you can. And if the family moves, the person struggling will have to move and adjust. And our goal is to get that person into help as the ultimate adjustment.
Amy, I think that brings me to you. And there comes this battle, right, with families. From my experience sponsoring guys, I think one of the hardest bonds to ever really break, or to break through, not to break, but to break through, is the parent to child, right? Parents, they're just natural instincts, right? Animalistic instincts kick in. I don't care. I'm going to do everything to keep my child alive, even with what they're doing is actually going to send their child to the grave faster. Talk to me about the difference between helping and enabling, because honestly, when a parent is in it, it is a blurred line.
Well, and I'm a parent, so I think that's exactly it. In enabling your child, you're not helping them, you're hurting them. You're actually digging the grave for them and denying it and thinking they'll get better on their own, thinking it will just go away. They need professional help, and you need to assist that process, but also take a step back and let go a little bit and realize that you can't control their actions, you can't fix them. You know, you can lead them to water, but you can't make them drink. So you really need the help of professionals.
But what would be some type of enabling behavior? I mean, you know, a mom or a dad has a child who's an addict. They know they're out there living. Mom and dad don't want to have a visualization of their child living out on the streets homeless, right? Mom and dad are going to sleep better at night if they're like, oh, let's just pay his rent so that he has a roof over his head, because that'll make me sleep better at night. You know, I'm their parent. I can't allow my child to be out on the street homeless. Or, well, they need a cell phone so I can check in on them, so I'll pay their cell phone bill. What are some of the behaviors that are enabling, and what are some that are truly helping?
Well, you just named a couple. So providing money, providing financial assistance, prolonging them hitting bottom, essentially, is what you're doing. You're trying to keep them safe in a bubble, and you're just prolonging them coming to the realization that they can't make their life worse. So you're just prolonging their agony, essentially. So financial assistance, you know, providing shelter for them. Let's see, are other things you can do? Ignoring it, thinking it will go away on its own, different things like that.
Yeah, and I've told parents, you know, too, at sometimes, you know, you don't have to pay for their phone, but you can answer their call.
Oh, always pick up the phone.
Always pick up the phone.
Always pick up the phone.
And always be there to say, hey, you ready?
And just say, are you ready to seek treatment? You know, and that's all you can do.
And Ramson, you know, Calvary has such a great reputation. It really does, about really seeing people come in and really succeed. You know, the efficacy rate of people after they've gone through the program, really doing well. But you really talk about, one of the concerns that I've seen is that when you have an addict, right, and they're spinning out of control in this universe of a family, it's like everybody's focus is on the addict. And what about the brothers and the sisters of the addict, right? And the parents are always just so focused on the one kid causing all the trouble that sometimes we lose focus of the whole family impacted by this. And you really talk about even recovery as a whole family unit getting somebody through.
Certainly, you know, addiction is a family disease, and kind of going off of what Carrie was describing of the system, you know, that you've got the family member who's the addict, it kind of finds himself centralized in the middle of that system. The thing that the people around them don't sometimes realize is that, you know, all systems like balance. They just want to even out. And so if the person that's been identified as the middle, the patient, or however a family identifies that person, if they're kind of swerving off balance, the rest of the family shifts to meet that balance. And so even if the person then comes in and, you know, does it fantastically in treatment, pursues 12-step and is sober, the fact is the family's changed and they may not even know it. And so you then send that person who's living a healthier lifestyle back into that old system, they're going to get pulled back into the old ways. So to protect the family and protect the person in recovery, you have to have support for the family. You have to have the family identify how they've changed their actions, behaviors, what they're willing to accept, how all that has changed to just cope with the negative behavior before, because now they have to shift back into a healthier lifestyle. And that way you're treating the whole system and not just the person who's been identified as the go-to. Because you're right, a lot of times family will come and say, fix that, and that's it. And it's like, well, we'll start there, you know, but there's a lot of other things we need to be focusing on.
Amy?
Well, those are tough dynamics to break. You know, when you have an active addict in the family and everyone's dancing around them, as Carrie was describing, those are hard habits to break, hard behaviors to break. And you're right, the addict or the individual suffering from the addiction is the designated patient, but really everyone is quote unquote sick.
And here's the good news, and one of the hardest things that I tell families I work with is that the person you care about, we can get them into treatment, but they're not going to come out fixed. They're going to come out better, they're going to come out with new tools, but they're not going to come out fixed. And a lot of families are like, well, what are we doing this for? Well, one of the greatest predictors of someone's long-term success in their recovery efforts is familial family support in the efforts for them getting healthy. So it's a lot about learning. It's a lot about understanding that which makes no sense, because you can't rationalize with irrational addictive thinking. But understanding it and learning how to make adjustments so that you can communicate in new and different ways and support in new and different ways makes all the difference in the world.
Well, what happens when an addict comes from a broken family? I mean, there's a lot of addicts out there that saw a lot of violence and saw a lot of domestic abuse, and maybe mom and dad are divorced and they fight all the time. And does that road to recovery for that addict in that sense become that much tougher? Because not every addict has a family willing to stand there and support them when they're walking out of the treatment center after 60 or 90 days. So what role does that play in helping an addict that does not have that familiar support?
Sure. I think the first thing that we've really shifted towards, I've been in the treatment world for over 20 years, and when I first got in, it was very much focused on here's the addiction, we deal with that. Trauma, all this other stuff, don't deal with that right now. Just focus on this. And go figure, when you do that, the person ends up relapsing and coming back into care. So treatment's gotten a lot more mature. Now we have to identify everything that this person is dealing with. If there's trauma history, if there's other mood disorders or whatever it is, we have to look at the whole person and try to treat the whole person, game plan for the whole person. So if somebody comes in and they don't have that family support, helping them identify not just what healthy boundaries they should set within themselves, but what healthy boundaries they can set externally is a huge part of it. And then getting them connected to a support community. That's, treatment, whether it's organized, clinical care, or whether it's social and sober support, it's done in a group format for a reason. This disease is an isolative one. It wants to get somebody to basically cut out everything from around them and just focus on letting the disease thrive and strive. And if you got a family system that doesn't support you and won't call that out, well, that's just going to fester. And so getting involved in maybe not a family system, but a support system that's going to be there and be a structure to help a person really adjust to a healthier lifestyle is so key in ongoing recovery.
You just triggered a word for me right there, isolate. And that takes me to my next topic here, and that's the pandemic in which we are all living in right now. I've been very open. I just did a podcast about a week ago and was very open for the first time publicly that I was extremely close, the closest I have ever been to a relapse in May. I just was. I'm going on 11 years. And I have a great support system around me with therapists and people connected. And I almost relapsed in May, right? You take me out of my routine. I'm a military guy with my routine sober. I was a mess when I was high on drugs. You put me sober. I'm like military about my day and my routine. You took that away from me. And I started to really spin. You take the meetings away, you take the fellowship away. The one thing we tell people in recovery all the time, especially when they're new, do not isolate. Do not be home alone. Do not be alone in your own thoughts. My goodness, I knew alarm bells went off the moment that the governors across this country were issuing stay-at-home orders. The first thing in my mind was not to care about the hair salons or the gyms. My concern was immediately, what about these people who we tell all the time to fellowship, to go to coffee, go to meetings? How the heck do we deal with recovery right now during a pandemic? And we'll go down.
Go ahead.
Well, I was going to say it's been very difficult because across the country you see liquor store sales go up, you've seen overdoses go up, mental health issues, suicidality has gone up, but people seeking care has gone down, in general. And so what we're trying to do is adjust to it. Now, residential and programs where you have to go into a hospital or a treatment setting, it's a little bit different. You're not going to do that virtually. You have to be there. So, what you do is you try to keep adjusting to what the CDC's requirements are. But the problem gets to what happens when a person leaves. The bulk of outpatient programs now are at the very least, at least offering a virtual component, if not completely virtual. And luckily, we're in a time where people are more used to, FaceTime and Zoom and all that stuff. So it's not as foreign as it once was, but still, it's not what a person's primary is. It's harder now to, if I have you sitting in front of me, I'm going to be better able to identify, all right, are the telltale signs of being under the influence there? What's going on? People are seeking treatment, just not at the rate they once were. And so we have to keep building the different supports around them. Things like this, going virtual with conferences, going virtual with 12-step meetings is another thing that's happened. It's caught on like wildfire across this country. It also allows for some things. You know, there are some people who seek residential treatment who then go back to their community, and there isn't really a setting that they could go to. It's more rural. And so what they found is if you can go virtually, at least it gives them that connection. So it's not all bad news. There's adjustments that are being made, and people are starting to clamor onto those adjustments gradually.
No, I think you touched on an important point. It looks different, but you can still reach out and make connections with people virtually. It's not the same, but it's better than nothing. And I also think that our coping skills, being able to go to the gym, go to yoga, a lot of those coping skills that people in recovery use, we suddenly can't, we don't have those outlets. So it's been challenging, but the good news is there are many apps you can put on your phone where you can, join a 12-step meeting all over the world, any time of day. A lot of meetings are going outside to the park right now, very early in the morning, but people are trying, they're adapting, they're evolving, and they're trying to stay connected.
Before we get to you, Carrie, my love language is touch. That's my love language. Words, meh, gifts definitely don't mean anything. It's touch, and I think truly that was one of the reasons that pushed me to the brink of a relapse. Just not having that touch. I don't have a partner at home. I live alone. So that even adds that component to it. Like you don't even have family or friends that live with you. I mean, you're just isolated and alone, and that I think is what almost drove me to that relapse.
Brandon, I really want to honor you and say thank you for giving recovery a voice, because like you, I'm in recovery myself, and I describe myself in my disease as an isolator that hates to be alone. So you reaching out, others reaching out and giving it a voice, because when you're in the grips of it, even as a family member, you think nobody else understands. No one's going through what I'm going through. No one knows the despair. And there's tons of people out there that identify and understand, but they keep it secret out of fear, shame, stigma. Am I people going to judge me? And the reality is, as we start talking about it, as we start saying there's hope, as we start saying you're not alone, pick up that 1,000-pound telephone, you can connect, and it's through that connection people heal.
It's interesting you say that, because, I should have picked up the phone in May. Right, I should have, and we know those things, but that's why I decided to share that openly last week in a podcast, because I sat there and said, you know what, Brandon, part of your ego state is like you want people to think that you're that really strong guy in recovery, that you don't have issues, you don't have bad days, you don't have those things. And I said, but that's not real, and I said, I needed to just tell people that, hey, listen, I got 10 and a half years and I almost relapsed. All right, that's how bad this disease can be. And that's how bad the situation can be. And you don't always have to be that strong person all the time. You got to let sometimes some other people be strong for you. And that's just something that I learned in this pandemic, thinking I was flying right along, everything was like really good. And then really something happened, a traumatic event has happened, and sometimes it's those little traumatic events that can spin us out of control.
Brandon, I'd like to kind of take it to the side a little bit and say those same options are there for family members. They're things like the PAL group, which is an Arizona, nurtured national organization. You've got Al-Anon, Nar-Anon, all these options, and they're all virtual. And so it's not just here are all these supports for your loved one, but get the supports for yourself. There are all sorts of gimmicks and things that we'll say out there, like if you're in the airplane and the oxygen mask come down, you put yours on before the kid, or if your foundation is shaky, you can't help somebody up. They all come back to the same concept. If you're trying to help somebody and you're on shaky ground, it's not going to work. So you have to make sure that family members, loved ones need to get the support they need so that they can do the things like get an interventionist and get involved in that kind of process where you can provide the support and accountability for your loved ones.
As we wrap up here, any closing thoughts, any closing message to those who might be listening right now?
For families, it's really hard, and I want to give all the families this message. when it comes to someone else struggling, it's hard to wrap your head around. But as a family member who loves someone, you didn't cause their problems. You cannot control their problems, and you're not the cure. And I always like to say, you have to look at the fourth C. What do you contribute to? Are you contributing to healthy decisions in a person's life, or are you contributing to unhealthy decisions and behaviors? Looking at the behaviors, not the words. It's about change for everybody and getting healthy for all.
I just want to say, don't be afraid. Don't be afraid to be vulnerable. Don't be afraid to ask for help. You are not alone, especially in the world today. And there are many resources available to help you even in the pandemic. And have the courage, reach out, pick up the phone.
I guess the most important thing I can say is that, it may feel insurmountable. It may feel like it's overwhelming, and at the beginning, everything always is. But the most important to remember is there's hope. As long as we don't give up, as long as we keep trying, there's hope. And we already know, and we've talked about all the help there is out there to provide that hope and strengthen it.
Thank you so much for being part of this discussion. I think with the pandemic, rather than seeing it as a negative, maybe we can see it as what have we learned about our industry? What have we learned about addiction and the resources that are available and not necessarily available when a crisis hits? So thank you very much for being here and lending your voice.
Thank you.
Thank you.
Addiction hurts passion. Addiction hurts dreams. Addiction hurts family. Addiction hurts. When you're serious about recovery, we're ready. Custom comprehensive programs that help restore and revitalize mind, body, and spirit for a lifetime. Come, experience the right treatment. Enjoy the look of recovery. Scottsdale Recovery Center. When you're serious about recovery.
As the PIO for CBI, or Community Bridges, Inc., we also recognize that as Celebrate, Believe, and Inspire. We have employees that work for us that are in recovery who celebrate recovery daily. Most of our employees, nearly 75% of them, are in recovery, which is so unique about us. They all believe in themselves and inspire others. And that's what we hope we did for you guys today, is inspired you to make change, learn something new, and share that information, help a loved one. I'm a real big fan, I always say this in my closings when I'm teaching, is, don't waste time, spend your time wisely. And I feel like with this pandemic, we've learned more than ever that life is precious. It's definitely a gift. So thank you for choosing to spend your time with us. We, again, hope you will share this information with loved ones. In conclusion, I would like to dedicate this show to Dr. Frank Scarpati. He was our Community Bridges CEO for over 23 years. Well-known man, loved and respected in the community. Kind of emotional for me because he was like a father to a lot of us who've been at this business for so long. He'd be so proud of what we're doing here today. So in his words of wisdom, I'll close with a Dr. Scarpati saying, he would always just tell us, good job. Do good things, Stephanie, keep doing good things. And I think here this year's CARE, we're doing good things. So with that, any final thoughts?
Yeah, I would say that I think we're doing a lot of good. I think we're doing a lot of good things. I think this seminar is really important, that people at home, you just never know when that somebody or somebody out there just needs to hear that message of hope. And so I hope that by all of us coming here together today, my goal is here just to end the stigma when it comes around mental health. We don't want to put a scarlet letter on anybody who has addiction or maybe suffering depression, anxiety. Let's not put a scarlet letter on them. Let's not judge them. Let's listen to them. And let's be that person who is open, who is willing to listen to that person, because you can survive addiction, and I hope that I can be an example of that. From the streets of LA doing all the drugs and all the trouble I got myself into, to now being the main evening news anchor for CBS News here in Phoenix. I want people to feel that hope. And I know it's really hard right now during a pandemic with so much thrown at us, being thrown out of our daily routines. But just know that there is help out there. There's resources available. Reach out, pick up the phone, and just tell somebody, hey, I'm struggling right now. Can you just help me out? And if somebody needs help, be that person to them. So I want to thank you very much for inviting me on. It's been so great to be part of this. And I hope this is the beginning of a conversation that we can all have as we continue to help people who are suffering right now from addiction.